why are some behaviours what we call sensory? What might a sensory behaviour present like or look like?
So sensory behaviors are typically automatically reinforced behaviors. Those are behaviors that we engage in that don't require somebody else. We're not looking for someone to give us something that we want. We're not looking to get out of anything in particular. Sensory behaviors, in appearance, are things like in individuals with autism, we see sometimes hand flapping. So we can gather that if that behavior's sensory maintained, that the person's looking for some sensory input. So some common sensory behaviors we see are things like skin picking, right? We all engage in picking our nails or biting our nails. Those behaviors are maintained typically by some type of sensory input we're gathering. In the previous video, we talked about function. We don't want to assume that all these behaviors are maintained by sensory input, but with some type of assessment, we can identify that. For the average person, sensory behaviors are things like maybe picking our skin, biting our nails, but things like masturbation is a common sensory seeking behavior, not for just typically developing adults and children, but for individuals with disabilities as well. That behavior doesn't require anybody to mediate it, right? It's very easy to get access to that reinforcer. So when we think of sensory behaviors, we don't always have to think of things like masturbation, but it's a very simple way to think about it. There's a behavior, there's a consequence. It doesn't require another person to. So skin picking, more socially appropriate. Behaviors like masturbation, this is why we often have to teach individuals that these behaviors occur behind closed doors, or they don't occur in public places because of the social appropriateness of those sensory seeking behaviors.
And would I be right in thinking, Brian, that sensory can also be pain reduction? Because, for example, I've worked with a lot of people in the past, for example, with autism. And when there's been a lot of stimulus that they're really struggling to process, they'll then, to me and you, it might seem really bizarre, but they might go and hit their head on something really, really sharp. But I've had that explained to me by people with autism, that it actually reduces the pain going on in their head because of all the excess stimulus. So sensory can also be pain reduction.
Correct. Yep. So very good point. The sensory input gathered from things like skin picking is typically input, right? But also pain attenuation. So if we have a tooth that's hurting and we hit ourselves in the face, we could deaden that nerve enough that the pain goes away. So again, from an individual who is engaging in some head banging, it could be with the functional assessment, we could identify if it's socially maintained, we would treat it that way. If it's maintained by automatic reinforcement, we look to see what can we do to the environment to make it less likely the person has to engage in that behavior. But excellent point. Yeah, we think of sensory input, but there's also the attenuation or the removal of some aversive sensation too.